Good evening and welcome to the program Your Health 360. My name is Jacqueline Adebija. How is everyone doing? You know, on Your Health 360, we always try to talk about everything and anything as concerns our health. That's why we're here. And the doctor's office has never been the easiest of places to be. It's either you're confused about the technical terms or you are just not forthcoming because you feel embarrassed for whatever reason. There are so many things that have the power to embarrass us at the, doctor's office, because we're talking about bodily functions. We're talking about, things that our clothes cover. So usually, a lot of times I would say, people find it difficult to actually be forthcoming with their doctors. And that is why today we'll be talking about questions you're too shy to ask your doctor. And to help us answer those questions today is Dr. Vanessa Haruna. Dr. Haruna, you're welcome. It's great to have you in the studio with us today.
Thank you very much.
Great to have you here. All right, so we're going to just start with the ones, usually these questions affect our sexual health. Where someone is asking, why do I feel in my penis while ejaculating? What could be responsible? Is it a danger signal? What exactly? Why? Why would someone feel pain while ejaculating?
Okay. First of all, pain while ejaculating is known as orgasmalgia, or this. So many causes of orgasmalgia. This could be a pointer to problems that are occurring in the genitourinary system. It could be a pointer that there could be an inflammation or an infection, or it could be as a result of obstruction in the genitourinary system. So the common causes of inflammation that can cause orgasmalgia include cystitis, which is inflammation of the bladder. It could be as a result of prostatitis, which is inflammation of the prostate. It could also be as a result of urethritis, which is inflammation of the urethra, and we know it is the passage through which the urine and even the ejaculate flows out. Mm-hmm. Yes. Then it could also be as a result of obstruction in the urethra, urethral stricture, which is either narrowing or blockade of the urethra, and we know it is also a conduit through which the ejaculate pass through. And orgasmalgia can also be a pointer to emotional or psychological disturbances, which can manifest in the form of depression, anxiety, or stress. A lot of times, men that are stressed out or are depressed can also, it can manifest as a physical symptom, and orgasmalgia can be one of the symptoms to show that one is suffering from depression. So this is a very, very serious problem, because it makes men to have low self-esteem. They could encounter problems in their sexual relationship with their partners. So for any person that is suffering from such, can do well to visit a urologist so that the cause can be identified. If it's as a result of any inflammatory process or any infection, it can be treated with antibiotics. Then if it's as a result of any blockade in the genitourinary system, it can be tackled with maybe surgeries may have to be done.
Well, just quickly, Doc, it's important that one asks these questions as you're giving us the answers. But before then, let me quickly say to us that we're also live on Facebook, so you can go drop your questions there. You can send your questions real time to the number 09072703270. You know the drill. You can send your questions to that place either via WhatsApp or via text. Dr. Vanessa Haruna with us in the studio. You talked about cystitis, urethritis, and all the itis of that, the genital and urinary tract area of the male, sexual or reproductive system. what are some of, just quickly, just so that we understand, what are some of the things that could cause inflammations in all these places, in the prostate, in, the bladder? What are some of those things?
Usually bacterial infections can cause such inflammations or infections in the urethral, in the genitourinary system.
Okay.
Yeah.
So usually infections could cause that. And one thing that you just said that was quite, for me, eye-opening was the fact that a man who is suffering from depression could actually manifest in him having pain when ejaculating. So it's not always a bad thing, but it's something that you need to have checked out.
Yes.
All right. Well, moving on to the next one. Let's talk about this one. My partner wants us to have sex, but I'm treating a sexually transmitted disease. He is also on treatment. Should we?
The answer is no, except if you must have started the treatment of the sexually transmitted infection the same day with your partner, and you must have had complete treatment for at least 7 days, because it has been found out that for treatment course of at least 7 days, the infection must have been treated. So it is advisable to wait for at least 7 days before having sexual intercourse with your partner, and at least you must have started the treatment the same time with your partner, or maybe your partner even started before you, because there is the risk of being reinfected by the sexually transmitted disease.
Okay. So, for instance, just for the sake of argument or for clarity, let's say, both of you started on the same day and you are at the same point, but you're still on treatment, you don't have sex.
No, you don't.
Why? You talked about reinfection, but both are on treatment at the same time.
Yes, that was what I said, except it is at least you've had the treatment for at least 7 days.
Okay.
You understand?
Okay.
Because by that time it is believed that the infection must have been treated.
Okay.
For at least 7 days.
So that means at least give 7 days.
Yes, at least 7 days.
All right. Let's quickly move on to the next, because questions I've gotten over time have been quite a bit. All right. So let's move on to this one. This one says, when my partner ejaculates, what comes out is so small, not even up to a teaspoonful. We don't have children, and I'm worried that this is the reason why. Am I correct?
Okay. You may be correct and you may not be correct. Just you seeing the ejaculate physically does not necessarily, it may be adequate and it may not be adequate. Usually for infertility, for you to say, first of all, that there is infertility, the couple must have been having regular, adequate, ejaculatory, penetrative vaginal sex for not less than a year. That is when you can establish that there is infertility. And the infertility could be primary or secondary. For primary infertility, the couple have not achieved any pregnancy at all before. For secondary infertility, the couple may have achieved pregnancy irrespective of the outcome. So for there are factors that can cause infertility. We have the male factors, we have the female factors, there are the combined factors, and there are the unknown causes. So for such couple, the problem can be with the male, or it can even be with the female, or it can even be both. So usually when couples present to a gynecologist, there are investigations that are done, and part of the one of these investigations is the semen analysis. So the semen that the man ejaculates is subjected to a test. So there are parameters that we check in this semen analysis. We look out for the volume. At least the volume of the ejaculate should be 2 ml at least. Then we check for the sperm count. At least 20 million cells per ml of ejaculate is adequate for fertility. Then we talk about the morphology of the cells. You know, some of the cells can have 2 heads, 2 tails. Those are not normal. So we look out for that. So at least the sperm cells in the ejaculate, at least 50% of them should have normal morphology. So we also check for the motility. At least 50% of those sperm cells should have adequate motility. So these are part of the...
So when you're talking motility, you're talking about movement.
Movement of...
the activity
yes.
of the sperm.
Yes.
You said at least 2 mil.
The volume of the ejaculate.
Yeah, because this person is concerned about the volume, obviously. I mean, the way it looks to the eye. So the average teaspoon is about 5 mil, I think. I should think so, about 5 mil.
Yes.
So even if it's smaller than the teaspoonful, it's still enough to get you
There
pregnant.
are other parameters too. Yes, at least the volume should be 2 mils. So she may be looking at it
with the physical eyes, obviously.
Yes, not subjectively.
Okay.
Yes.
All right. So bottom line is you need to get yourself to the doctor, let him ejaculate into a container and then have it analyzed, right? Okay, so still with Dr. Vanessa, and we're talking about questions you're too shy to ask your doctor. Let's move on to the next quickly because, like I said, so many questions. That's why Dr. Vanessa is trying to be very quick with her answers. But of course, we will open up the phone lines so that you can ask her questions if you want to. I find that phones are easier because, you know, you're not looking at the doctor face to face. Anyway, so let's move on to the next one. This one says, my partner has an awful smell down there. Whenever I tell him to go and clean up because it's smelling, he says it's only female genitals that can't smell, that men don't. So he thinks I just make this up as an excuse. Is it true that men cannot smell down there?
It's not true. Both the males and the females can smell down there. Now, there are so many causes. There are so many things that can make a man to smell down there. One of the factors is the hygiene. Some of the men, you can find some men wearing boxers for like 2 days, 3 days. Come on, no. And some of them, they don't even wash the penis. You know, there's this thing called smegma, especially in men that exercise. We know men usually engage in more vigorous activities. Mm-hmm. So build-up of this smegma, which comprises of moisture, the oils, and then dead cells, they can form white flakes. And if this is not washed off, it can be a medium for bacteria to grow. Okay. And we know bacteria, when they grow, they can cause awful smell. Mm-hmm. This is one of the cause of smell in the male genitals. Also, sexually transmitted infections. We know some of them cause some discharges that are offensive. So they can be another cause of smell in the males. Then also urinary tract infections. They also come with some discharges that are very offensive. So it is advisable that at least men should change their undies at least once in a day, and they should also wash their penis at least once in a day. And if they notice any form of discharges, they can present to a urologist. If it's as a result of bacterial infections or fungal infections, antibacterial or antifungals can be prescribed to them, which will help.
Talking about smegma, something that their bodies, produce naturally. You're talking about oils and dead cells and all of that. Do men who are circumcised actually excrete smegma, or is it something found only in the uncircumcised?
No, they also do, but it is more common in the uncircumcised men.
Okay.
Yes.
Okay. So even the circumcised men actually produce smegma,
yes.
But it's not as obvious as in those who are uncircumcised. Yes. All right. So quickly, before we move on to the next question, for a man who doesn't have infection, and is clean in quote, can he still have smell? They say it is the vagina that is open. It's like an open wound. There's nothing for men to, worry because all that place is skin. But is it really as what's the word I'm looking for? Is it really as sealed as a lot of men seem to think?
No, it is not, because some of the men actually wear tight on this, and we know it's a skin, so we sweat. Anywhere there's skin, you can sweat.
Right.
So it can be a build-up. So they can also actually have a full smell down there.
All right.
Yes.
All right. So let's move on to the next. Now we have another question that says that I see small blood every time I have intercourse with my husband. Why?
Okay.
So this would mean that this is beyond just the menses, the monthly flow. I would take it, since it's every time.
Okay.
You know.
Yes. Bleeding after sex is known as postcoital bleed. Now, the factors that cause this depend on the age of the female. In the younger females, that's females that are not up to the perimenopausal age or menopausal age, which is the age is below 40 years. Usually, before any sexual intercourse, it is advised that foreplay is done, so that this helps to release the lubrication, to lubricate the vaginal area, so that during penetration it will be smooth, there will be no friction. So in such women that don't really attain full arousal, you usually find them being dry. And since sexual intercourse is a vigorous process, it can result to friction, and they can have some bruising. And after sex, you could find them having some small bleeds. Then some of the women engage in douching. After the sex, they usually wash off with some fragrances or some wash that have some chemicals.
Right,
yes,
up into,
and they wash it vigorously to really bring out the semen. So that can also cause postcoital bleeds. Then it could be a pointer to something serious. Some women can have hormonal imbalances. We know the estrogen is secreted, and this helps to release this cervical mucus and lubrication. So some of the women, because of these hormonal imbalances, can be suffering from vaginal dryness. So this could also predispose them to bruising and bleeds. For those women that are around the perimenopausal age and the menopausal age, they usually undergo vaginal atrophy because there's a decline in estrogen level due to atrophy of the ovaries. And we know the ovaries are the organs that secrete the estrogen. So that can also predispose them to...
What do you mean by atrophy or atrophy? They're
shrinking? The ovary shrinks. Okay. Yes, yes. So that can predispose them to vaginal dryness, and they can also encounter this postcoital bleeding. Then for postmenopausal women, actually, postcoital bleeding is a very, very serious condition. It's often said that it is cervical cancer until proven otherwise. So for the fact that I said it depends on the age, it doesn't necessarily mean that this postcoital bleeding, even in the women of younger age, could not be heralding cervical cancer. Yeah.
So it's something that one should take seriously.
Yes, one should take seriously.
You first go to the doctor, complain,
yes.
Let cervical cancer be ruled out before any other thing can be. So what kind of test do you really go when you get to the doctor? What do you say? I mean, a lot of times people are so shy, so you just say it.
You just say it. You don't have to be shy with your doctor, because the doctor is there to help you.
All right.
Yes.
So you just go and say it so that tests can be run.
Yeah.
Cervical cancer, correct me if I'm wrong, is one of those cancers that when caught early has a very good outcome. But
very
because
true.
a lot of people are
present
so shy,
late.
They would present late, and it's rather too late at that time. So seeing blood after intercourse for a woman, you should quickly go and see your doctor. Let's move on to the next one. I'm newly married and trying to understand my ovulation, but I haven't seen the long and elastic discharge the doctor said I will see before I ovulate. It's over 6 months that I have been observing my discharge. Should I be worried?
Yes, you should be worried because the long elastic vaginal discharge is known as the fetal cervical mucus. So it's a pointer to the fact that ovulation is will soon take place,
okay,
or it has already occurred. And this elastic watery vaginal discharge helps to facilitate the movement of semen into the cervix and into the uterus for fertilization to occur, except for some women that are taking some medications like oral contraceptive pills. Some medications like cough, asthmatic drugs can dry up this mucus and make it the pattern to change. But for a woman that desire fertility and you're not on such medications, it should be something of concern because it could be a pointer to the fact that you may not be ovulating,
even if you are menstruating.
Yes, there is this thing that is called an ovulatory cycle.
Okay.
Yes. So and again, it could be a pointer to the fact that you may be having some form of hormonal imbalances.
Okay.
Yes.
All right. Let's quickly move on to the next before we go on a quick commercial break. The next one says that my wife's breasts bring out water, but she hasn't been able to conceive yet. What is wrong with her breasts?
Okay.
Do you know, funny enough, doctor, just as an aside, I've heard someone say that he's suspecting that his wife has had children before marrying him because of this particular matter.
Okay. There are so many causes of this. This is actually called nipple discharge.
Okay.
This can be a thing of concern, actually. Now, depending on the fact that this nipple discharge, it could be something physiological, it could be pathological. Now, is it from just one breast, which we can say unilateral, or is it both breasts, bilateral? Now, the nipple discharge, is the discharge clear or milky, or is it bloody? So, this nipple discharge, it could be as a result of some physiological processes. Like those people, usually before sex, the foul play, we find out that some men will suckle on the breast, stimulate the breast. You know, that stimulation can send signals to the brain. The brain will release a hormone called prolactin and oxytocin. Prolactin is responsible for milk production, while the oxytocin is responsible for the milk discharge. So in such kind of people, it's possible to have nipple discharge. So it wouldn't be something of concern. Then for some people, they could have some conditions, one of which could be pituitary tumor. The pituitary gland is found in the brain. That tumor can cause secretion of high levels of this prolactin, and this prolactin, when it is in high amounts in the body, it can cause suppression of ovulation, and ovulation is necessary for fertilization to occur. If there is no egg that has been released and then you're having sex, the sperm, there's nothing to fertilize. Mm-hmm. So this hyperprolactinemia from this pituitary tumor can be a cause of this infertility in this person. Then the woman also can be suffering from breast diseases. It could be benign breast disease or a malignant breast disease. So these are part of the causes of.
Okay, so
nipple
just to
discharge.
quickly rule out the one that you said, people don't really have to be worried about that one, and that is after the breast has undergone some sort of stimulation from the partner of that person. Would such discharge be only during that period, or from that period over a certain period of time and then it would stop? Or what exactly would they be likely to witness?
Okay, as long as that stimulus continues, then you expect the discharge to continue. But once the stimulus has been withdrawn, after a while it will stop. It's just like a breastfeeding mother, because the baby keeps suckling, so there's this feedback that keeps going, and then there's milk lets down. But when a woman stops breastfeeding, after a while the breast milk stops coming.
Right. Yes. So such couples, the discharge or whatever it is that the man is feeling in his mouth or whatever should stop immediately after the stimulating whatever has stopped.
Not immediately, really.
Okay, not
after a while, it's signal.
Okay.
Do you get?
So when you say after a while, doctor, let's be specific. Are we talking hours, days?
No.
Weeks?
It could be weeks. So it could be days, depending on the physiology of the...
My question now would be, what happens if the couple are regular, like have intercourse regularly, and this person... So how do you know the difference? Because if they're having intercourse regularly, that means that she's going to constantly have discharge coming.
Usually such kind of people, when they present to a gynecologist, they usually advise for them to stop, because the more he suckles, the more the signal keeps going and prolactin is being released, and more the level of prolactin is in the body, it can suppress ovulation, which can cause infertility.
Okay, so that would mean that, because conception cannot take place either without the sperm. So that would mean that such a couple should be able to carry out intercourse without stimulating the breasts.
Yes,
that's what the doctor would tell them.
There are other foul play that can be done.
Just to be clear, it's just so that we're clear.
Yes.
That means that such women, the doctor would advise that their husbands not stimulate their breasts, even if they can still have intercourse.
Yes, mind you, it's not in everybody that occurs. You get me?
Yes.
So for some that are at risk of that, they could be asked to
desist from stimulating the breast or nipples.
Yes.
All right. So we can see that sometimes some of these things are counterproductive, because if sucking the breast is making her release hormones that are counterproductive to conception, that's like working against oneself. All right. So that just goes to say that men should become more observant of their wives, especially those who are still in the business of starting or continuing their family. Let's go. I think we need to go on a quick commercial break, and then when we get back, there's still loads of questions, but we will also open the phone lines. We will be checking all other modes of channels of communication to see if you've dropped any questions. Let's go on this quick commercial break. We'll soon be back with Dr. Vanessa Haruna. Stay with us.
Made for
all right,
to moisturize our skin.
So buying lubricants is money well spent. That's what Dr. Vanessa is saying. Let's move on to another. The calls keep coming in and getting cut off. My apologies. It's not our fault here. Maybe it's the network. I don't know. But let's take this one. We have just 5 minutes left. And this one says that my wife farts a lot, even when she's sleeping. Is this a symptom of a sickness? Farts, that is, she passes gas a lot. All right.
So passing gas is known as flatus. So gas usually is a product of digestion of food in the large intestine due to breakdown of the food by the bacteria. So usually this...
Sorry, Doc. Let's just try and take this call. I see that it stayed for a while. Hello. Good evening.
Good evening.
Yes, please Just 30 seconds. And it's gone. Go ahead.
Okay, so this buildup of gas is passed out as flatus. Also, swallowed air constitutes this gas. So it could be normal, it could be abnormal, depending on the situation. Now, there are some habits that can make one to fat a lot. For some for the habits, we have people that eat hurriedly. They eat so fast. So in this process, you could swallow more air, and that can accumulate.
Okay.
Then for people that talk while eating, you could also swallow more air, and this gas too can also accumulate. So such people can be found to fat more often. Then there are some diets too. There are some food that have been associated with passing flatus more often. We have food like the beans, the peas, taking carbonated drinks, Then there are some conditions also that can predispose one to fats more often. It could be as a result of constipation, inflammatory bowel diseases can cause that. Then for there are some people that it could be as a result of damage to anal sphincter. Usually there are sphincters in our rectum, the internal and external sphincter, that enable us to be able to hold flatus. That's why sometimes you may feel like farting, but because you're in public place, you could actually hold it and go somewhere.
Right.
Yes. Then
so what are some of those things that could cause damage?
Yes, like some pelvic surgeries, you could damage the sphincter. Then during childbirth, it could also predispose to damage. Then for this question that says the wife farts a lot at night. When we sleep,
he said even when she's sleeping.
Yes,
so that means she farts every time, but even when she's sleeping, it still happens.
Yes, even when we sleep, it's normal, even in normal people, to fart, because when we sleep, our muscles relax. These sphincters also can relax, and they can some of the gas can pass, but the sphincter relax not up to the level that can allow passage of stool.
Okay.
You get?
Okay, so gas can pass, but not stool.
Yes, even
so
in
we
normal
shouldn't
people.
have people stooling in their sleep simply
because
it's
not normal.
It's not normal.
Yes.
Dr. Vanessa, we'll have to have you come back next week. We've run out of time. I see a lot of people sent text messages on the phone, and Wisdom has been able to extract them for me. I'm seeing, can a woman still conceive after an ovarian cyst? I'm seeing, if I have sex during my period, what can it result into? And then, of course, there's also a question about specific sex positions. Do they determine the sex of a child? That is, can your sex position determine a male child? Well, Dr. Vanessa will not be able to answer that. That and any other question that you have, you'll have to send it, because up next we have Your Health Today with Dr. Zainab Idris, and we have to go for that right now. At this point, would like to thank you, Dr. Vanessa. We hope you'll have time for us next week, because as you can see, there are quite a number of questions that need answering.
Okay.
So we do look forward to seeing you next week.
Oh my God, that's great.
Well, thank you so much. Stay
Thank
with
you
us.
very much.
We'll be back in a moment. It's still Your Health 360.